the time, yes.
All right. Are you a member of any professional organizations?
Yes, I'm a member of the National Association of Medical Examiners, the College of American Pathologists, the American Society for Clinical Pathologists, and the United States and Canadian Academy of Pathology.
All right, sir. And what basically does a forensic pathologist do?
Well, we're physicians, and we examine bodies externally and internally and look at things microscopically if we need to determine how someone dies.
Can you do that?
Yes, sir.
All right. That's the general purpose of an autopsy.
That's correct. Determine how and why someone dies.
Have you qualified in any courts anywhere as an expert in the field of forensic pathology?
Yes, I have.
And where have you been qualified?
Davidson County, Rutherford County, and a number of smaller counties throughout Tennessee.
All right. And have you ever testified as an expert there?
Yes, I have.
I'd like to have Dr. Davis here declared a forensic pathologist and an expert in the field of forensic pathology.
Okay, ladies and gentlemen, I deem that Dr. Davis is a qualified expert as a forensic pathologist.
Dr. Davis, in September of 2011, were you qualified or were you employed as assistant medical examiner in Nashville at the Office of the State Medical Examiner?
Yes, it was.
Did you have occasion to do autopsies on 2 infants here from Sumner County?
Yes, I was.
All right. And I'd like to ask you, how did you receive these infants?
The infants were received in a plastic laundry basket surrounded by a comforter.
Okay. How are the babies identified, Dr. Davis?
They had tags on their ankles, I believe, and they were labeled as baby boy, Lowe number 1 and number 2.
Okay. Got a photograph here I'd like to pass to you, Doctor.
Yes, I can. This is how they were received to us at the medical examiner's office in Nashville.
Pass the laser light to you. Just the top button. Dr. Davis, is this how the babies were received by you?
Yes, sir, they were.
How did you identify the babies for purposes of autopsy?
We used a labeling received from outside the county, and we labeled baby boy number 1 the same, and we generated a unique number for the infant as MEC 11-1754. It's at the bottom right there on a ruler, and it's also on a tag underneath that. Right there. There's a number on this ruler. It's centimeters on one side, inches on the other. It says MEC 11. Each case that we investigate has a unique number, the 11 based on the year, and then the 1754, it's the 1,754th case of that year. And here the number is written in Sharpie pen, same number as the ruler, and baby boy Lowe number 1, and over here baby boy Lowe number 2, and his number is probably 1755. Yes,
1754 and 1755.
that's correct.
When the state lights and the babies all the way through the autopsy.
That is correct. Every photograph taken with the child will have a ruler with that unique number.
You think that makes a big difference?
Tip number 85. Turn the lights on. Okay, thank you.
Dr. Davis, with regard to baby boy number 1, did you determine a pathological diagnosis?
There was nothing congenitally wrong with this child as far as diagnoses. The diagnoses I have were mainly descriptive as far as determining the age of the child, gestational age, and other physical findings.
What is a pathologic diagnosis?
It's mainly things that are potentially abnormal or things we can actually quantitate. Typically, in these cases, if there was something physically wrong with the child, that would be a diagnosis. In this case, they're more descriptive since there are no physical findings that account for this child's death.
All right. And in your report, you're looking at your report, did you not?
Yes, sir.
You've prepared reports for both of these children.
Yes, I did.
In your report, under pathologic diagnoses, what do you have as far as your findings or determination, I should say?
The first finding was how old these children were. What was the gestational age? And I determined 40 weeks based on a number of different parameters, based on organ weights, foot length, head circumferences. These all come from textbooks that have numerous data points, and you determine it within the range of that particular age based on the weights. Foot length is the major one.
Okay, and of course, gestational age is how long the mother carried the child.
That's correct.
All right, and you estimated it at 40 weeks.
Yes, sir, that's correct.
Is that full term?
Yes, it is.
All right. Did you determine whether or not there are any kind of congenital abnormalities?
There were not. Either grossly with my eyes, internally, externally, and microscopically, there was nothing wrong.
What about the child's lungs?
The child's lungs were aerated, meaning that they were inspired air in utero, in the uterus before they're born. The lungs, the alveolar spaces, those are the spaces that oxygen is exchanged between the blood and the air. They're collapsed or filled with fluid. They don't actually open up and fill with air until after they're born and they take their first breath.
All right. So when the child, just before the baby is born, there's no air in the child's lungs.
That is correct.
And when the child is born, if this child is born alive, there is air in the child. I'm just trying to. All right. You tell it instead of myself.
Before they're born, the lung spaces are collapsed where they're filled with fluid. After they're born, their first breath displaces the fluid, they get rid of the fluid, and the lung spaces are filled with air.
Was baby boy Lowe number 1, did he have lungs filled with air?
Yes, there's a pretty simple test we can do. Do the lungs float in water? If the lungs are filled with air after they have breathed, the lungs will float visibly in the water. If it's not, if the lung spaces are collapsed or filled with fluid, they will sink. They do not fill with fluid, do not fill with air before they're born. So if these children either died in utero or were born deceased, their lungs would sink in the fluid, in water, and they both floated.
All right.
Meaning that the air spaces were both filled with air.
All right. Right now, let's just stick with baby boy number 1, and we'll get to baby boy number 2
Yes, sir.
here in a little bit, okay? With regard to baby boy number 1, you performed a complete autopsy. Is that correct?
That is correct.
Were you able to determine the cause of death to baby boy number 1?
I determined the cause of death is suffocation due to smothering.
Did you determine the manner of death?
Yes, homicide.
Did you determine the circumstances of death?
they were smothered by someone else.
How much, I'm sorry, what was the weight of baby boy number one?
The weight was 6.5 pounds.
Okay. Did baby boy number one appear to be well nourished?
He was a healthy appearing child.
All right. Did you determine anything that was physically wrong with baby boy number one?
The only physical finding I have is a subgaleal hemorrhage, which is kind of blood between the scalp and the skull, and those are very common in vaginal deliveries.
Would you determine that to be an abnormality at all?
It's a finding, but as far as it's not uncommon to see that. Actually, I think most vaginal birth will have some level of subgaleal hemorrhage under the scalp.
Can you tell us for certain, within a degree of medical certainty, Dr. Davis, whether baby boy Lowe number one was born alive?
Yes, he was, absolutely.
Was the baby boy number one healthy or not healthy?
There were nothing physically wrong with this child, either grossly with my eyes or microscopically.
All right. What happens when a newborn baby cries, Dr. Davis?
A cry indicates that there is some air. We don't make noises, crying or verbal noises, without air passing over our vocal cords. We need to have air in our lungs for that to happen.
Did you have any other indicators that would tell you whether or not baby boy number one was full term?
With the exception of lots of different factors we looked at. Crown hill length, which is the length from the top of the head to the heel, head circumference, chest circumference. There's some variation there between gestational ages, but the big determiner would be a heel length. Especially twins will have less weight on them than a singleton birth because they're competing for space. But the heel length is the best determiner for gestational age.
The heel length?
Yes, sir, from the heel to the toe.
And what was the heel length?
It was 8.6 centimeters.
What did that tell you?
It tells me based on the charts that I used to determine gestational age that it was within 40 weeks.
Okay. I've got 3 more pictures to show you. Can you identify this photograph here, Doctor?
This is a photograph of the back of baby boy number one.
All right. What was the purpose of taking that photograph?
These are determined, it's documentation of physical findings or lack of physical findings. This is just a photograph overall from the head to toe of the back of the child.
So what did that show you?
But there's nothing wrong with this child as far as anything externally.
Is that a normal baby boy?
Yes, it is.
I'll have that marked as the next exhibit, Your Honor.
Exhibit number 86.
It might be a good idea for us to, since we have 2, to make these collective exhibits so we can keep them separated. Two babies. Would you like us to make collective exhibits or?
Okay, collective exhibit number 86 on baby boy number one.
Okay, thank you. Got another picture here I'd like to pass to you to see if you can identify that.
This is a side view of the left side of the head of baby boy number one. And again, just the left side of the child's head.
What does that tell you?
That the child was healthy. There's no signs that this child died in utero or was stillborn. You typically can see on children that are die before they're born, the skin will have a red-brown appearance to it, and the skin will actually slough off. It's called maceration. It's kind of just a breakdown of the tissue. There are no signs of that on this child.
Part 2 of the collected exhibit, please, Judge.
Yes, sir.
Can you identify that photograph?
It's a headshot of the same child.
Showing the face?
That's correct, yes, sir. Looks a little more purpley here than it truly does. But once again, it's a head-on photo of focusing on the child's face.
And what does that picture tell you?
There's no skin sloughage, no peeling of the skin. It's not a red-brown discoloration. It's a pink. Once again, it looks more purple and congested here, but that's not the case. Just the way it's projected on the screen. There's no trauma to the nose or mouth. It's a normal appearing newborn child.
Part 3 of the
Yes. Deputy Rice, let's mark those collective exhibits A, B, and C.
Dr. Davis, when was it that you performed the autopsies on both of these little babies?
September 15th, 2011 at 9:30 a.m.
Now, with regard to baby boy number 1, you have determined that the cause of death is suffocation due to smothering.
Yes, sir, I did.
Were there any physical signs or any physical evidence that this baby had been smothered?
No, and that's not atypical. Typically, children, infants who cannot resist smothering comes down to a documentation of a lack of injuries. If someone were to smother an adult, there'd be a fight, an altercation, and you'll see tears and scratches around the nose, tears around the mouth and lips. Kids can't do that. Infants can't do that. So you don't see tears in the mouth, tears of the frenulum, bruising of the mouth or lips, no abrasions. And it comes down to scene investigation on how the children were found.
I've got have you got a copy of your report with regard to baby boy number 1?
Yes, sir, I do.
And on the front page of that report, Doctor, what is the front page of your medical examiner's report?
The front page generated by support staff is mainly demographics as far as the name of the child, age, address where they were found, and it is a short narrative paragraph as far as what led up to the death or how the person or individual was found.
This is not something you yourself do, is that correct?
That's correct. I do not do that.
All right. In the front page, it actually has a name on it on the front page for baby boy number 1. Is that correct?
It does, yes, sir.
What was that name?
It is Mark Alvin Michael Lowe.
Did the babies have names at the time that you performed your autopsy?
No, sir. They were just labeled as baby boy number 1 and number 2.
All right. And this sheet, was it added after you had performed your autopsy?
Yes, it is.
All right.
Yes, it was. Excuse me. Yes, it is.
Exhibit number 87. Sure. I assume that you've seen it. Go ahead. Sure, go ahead.
87.
The report was 87.
Just a moment, Your Honor. Dr. Davis, let's move to baby boy number 2. Did you perform a full autopsy on baby boy number 2?
Yes, sir, I did.
And I want to ask you again, with regard to baby boy number 2, did you make any determinations regarding the pathologic diagnoses?
Yes, I did, and they were similar to his brother, baby boy number 1, as far as the gestational age, the absence of anything as far as birth defects, the fact that the lungs floated and that they were aerated microscopically when I examined pieces of them under the microscope, and the presence of subgaleal hemorrhages, which you can see very commonly after a vaginal birth.
So what does all of that tell you in summary as far as a pathologic diagnosis?
These kids were, this child was normal. He had no birth defects. There was nothing physically wrong with him, microscopically or visibly.
Were you able to determine the cause of death?
I guess it was same suffocation due to smothering.
And were you able to determine the manner of death?
Yes, homicide.
And the circumstances of death?
It was smothered by another person, someone else.
All right. What was the weight of baby boy number 2?
6.5 pounds.
And the same weight as baby boy number 1?
I believe so. That sounds familiar. Yes.
Well, doctor, you said the gestational age was the same or approximate. What was the gestational
40
age?
weeks, a term of birth.
Did you find any abnormalities, whatever, on baby boy number 2?
Nothing, with the exception of, once again, just that hemorrhage between the scalp and the skull.
Was the baby what you would call a normal infant?
Yes, he was.
Healthy infant?
Yes, he was.
I've got some photographs I'd like to pass. Identify this photograph, Dr. Davis?
It's a torso shot and lower half of the head of baby boy number 2.
All right. Is there anything a little different about this particular picture from baby boy number 1?
This one has a portion of the umbilical cord around the child's neck.
Here, you take your pointer there, your laser pointer, and describe what this picture really does disclose.
Here's the end of the cord. This is the part that will probably attach to the placenta, which is what nourishes and keeps the kid alive in utero. And it's just draped around the neck here.
Was that, did that umbilical cord, was it strangling the baby?
No, sir. Umbilical cords on the neck are not uncommon. The factors that take into effect is how long the cord is. Sometimes if the cords are short, and as the babies deliver, they tighten up around the neck without actually physically being there and delivering the kid. I don't know if he was born with the cord on the neck or if this cord came draped on his neck upon placement into the basket.
Did that cause any problems for this little baby?
No, it did not. There were no. Usually, if there's a strangulation, you should see some indentation or hemorrhage into the neck muscles. That wasn't the case here.
Did we make that
To be collective exhibit 88A.
Can you identify this photograph, Dr. Davis?
It's a photo of the back of the child, full length. Another normal term infant, from head to toes. The white is kind of lanugo. It kind of keeps the kid's skin lubricated when it's in the uterus of the mother.
That's natural.
That's natural, absolutely.
Do you see any abnormalities, whatever, on this particular shot?
Just with the exception of the cord around the neck, everything is normal.
The next exhibit, Judge.
88B.
Can you identify that photograph?
It's a side view from the right side of this child's head, a baby boy number 2.
See anything abnormal there in that photograph?
No, I think it looks more purple here in the photograph, the way it's presented up on the screen, but it's a normal appearing child.
Purple would be no cause for concern.
No, sir. You have some purpley discoloration you can see post-mortem as blood settles. It's called liver. It can be confused as bruising. That just happens after death. That's not the case here. It's just the discoloration from, I believe, the way it's presented on the screen. Projected, on the screen.
C.
Yes, sir. 88C.
Lastly, can you identify that?
This is a picture of the face of the child with his number 111755. It's a little more purpley here. It's a little lumpy head, but that's right here. It's totally normal after a vaginal delivery. You can have some little bumps and lumps on the head as they've been squeezed through the birth canal, but nothing abnormal. 88D.
Dr. Davis, I believe that Detective Steve Malik from the Hendersonville Police Department attended the autopsy. Is that correct?
I don't remember.
Okay.
I don't have it documented on my report.
All right.
That was a little while ago.
All right. That's fine. Did you have information about this case before you actually did your autopsies?
The fact that how they were found, and I believe, I'm not sure if at that point in time we had admission from the mother. I believe at the time I had was that the children were found in a laundry basket, and that was the extent of what I knew, what we knew at the time of autopsy.
All right. Did anyone tell you that there was that the mother had said that she'd smothered the children?
I don't recall at the time of autopsy. I believe all I have in the narrative summary, I don't recall what happened actually at the time of the autopsy, those details. It's under narrative on the front page says charges are pending of the mother. So I don't remember exactly what information I did have, except that how they were found and determine how old they were and how they died. And were they alive when they were born.
Again, at the time that you performed your autopsy, well, let me back up. Do you have a report that you have made and generated with regard to your autopsy of baby boy number 2?
Yes, I do.
I'd like to ask Mike to ask you if this is a true and accurate copy of your report regarding your autopsy of baby boy number 2.
Yes, it is.
Exhibit number 89.
Is it your testimony, Doctor, that both of these baby boys were smothered?
Yes, correct, yes.
Is there any other plausible explanation for their deaths other than smothering?
After the autopsy, on smothering cases, there aren't physical findings. It comes down to scene investigation also. Based on this, there's no other reason as far as these kids did not have any birth defects. These kids did not have any active infections. These kids were born alive. So based on that information and the information we got from the scene, yes, death was due to smothering. It is a homicide.
All right. But you don't, do you know of any other medical reason that they would be dead other than smothering?
No, I don't.
What can you generally say about both of these two little baby boys?
These kids were in pristine condition. They were normally developed. They looked healthy. Everything was developed the way it should, externally, internally. There were no microscopic pathologic processes as far as infections in the major organs. Nothing was physically wrong with these children.
That's all the direct I have, Your Honor. Thank you, Dr. Davis.
Welcome.
Mr. Pellegrin, you may cross-examine.
Dr. Davis, the gentleman seated over here at the end of the table with the plaid tie is Detective Steve Malik. He's the lead investigator in this case. And do you not recognize him or remember him being present at the autopsy?
I don't recall. I don't actually annotate who's present for the autopsy. It would not surprise me to have law enforcement involved in this case.
Well, I think you said a moment ago that your determination of cause of death comes down to scene investigation.
That's correct.
Right. And
not entirely, but it is extremely helpful.
Sure. And you didn't go to the scene.
No, I did not.
All right. And so whatever you used for scene investigation was communicated to you, I assume, by law enforcement.
Yes, and actually determining how we received the children in the basket with the blankets on top of it.
And I understand that this autopsy was not recorded. That is, there was no audio recording of the autopsies that was being done.
That's correct. I take notes on a dry erase board, and then afterward I dictate that, and it's transcribed.
Okay. And it is common practice, is it not, for there to be an audio recording a lot of times when an autopsy is performed?
I've never been in a place where it does that. People do audio recordings during the autopsy. Each person does things differently. Some people dictate as they go along. The places I've worked at does not do that. They take notes. and then things are transcribed.
And if a detective was present, would the detective dress out for the autopsy? That is, have scrubs, gown, gloves, that sort of thing?
Scrubs not, but they would have gowns on, would have protective gear protecting the face from splash hazards and things, would have a gown on, shoe covers, gloves plus minus. If they actually want to get closer, gloves may or may not be present, but definitely a gown and a face shield and shoe covers would be on.
And doctor, in medicine, tell the ladies and gentlemen of the jury what a differential diagnosis is.
It's a list of things that could potentially cause the illness. You have a cough, it could be viral, it could be bacterial, it could be from smoking. So there's a list of things that could potentially cause the illness, and then you work down ruling things in or out based on other symptoms, other findings.
And similarly, if you're determining cause of death, and I may not be using the right term to call differential diagnosis, but the same principle could apply. You might do an autopsy, and in a particular autopsy, there might be more than one possible cause of death.
You can narrow things. Yes, there might be, but usually it's within a scheme of things. If it's natural, someone might have high blood pressure and diabetes. Which one killed them? It comes down to other things. But as far as these things, I think there's limited to the scene investigation and other findings as far as the children being normal.
And doctor, were you told that these babies were delivered in a toilet bowl?
I heard the possibility it might be delivered in the toilet bowl. I heard they were delivered in the bathroom. Whether or not both were delivered in the toilet bowl, I'm not sure.
And
I'm sorry, go ahead.
If let's assume for a moment that both babies were delivered in a toilet bowl, one baby on top of another baby could cause one to have breathing problems.
So you're suggesting that one child drowned after he was born? Is that?
No, sir. I'm just saying if one baby was born and then another baby was born and was on top of that baby in a toilet bowl, in the confined space of a toilet bowl, couldn't that affect the ability to breathe of the baby on the bottom?
If the baby is being compressed as far as the chest, things that actually cause us to breathe, our chest has to expand. If things are pressing down on the chest for any reason, whether it be a force or another body, the way our body's positioned, if we're curled up, that can all affect our ability to inhale. So yes, it's possible.
Okay. And if in fact the amniotic sac, if I'm using the correct word, were also in the toilet bowl on top of infants in the confined space of a toilet bowl, that could also have an effect on an infant's ability to breathe.
Any weight placed on top of someone's chest can inhibit their ability to inhale and breathe, yes.
And did you, the placenta, there was one placenta for these two babies. They shared the placenta.
Yes.
And what do you call that?
It's a monochorionic diamniotic placenta. It's a shared. Some placentas are separate. This one's not. You can share a placenta and have two different sacs. That's the sac that goes around the baby. You can have a placenta and one sac covering both children, or each child have their own sac. Each one is different.
And from photographs I've seen of this autopsy, the sac looked to be about the size of a football. Would that be roughly accurate?
It has to be big enough to cover the kids. Usually the kids are all curled up with their knees up around their shoulders. I don't remember the size of the actual amniotic sac on this particular case.
And I'm assuming as part of the autopsy you didn't weigh that.
The sac, no, I'll probably weigh the placental disc. I'm not sure if I did in this case.
Okay.
But the sac is not weighed. Usually when you measure the disc or weigh the disc, the sac and the cord are cut off, and you examine just the placental disc itself.
And if, in fact, two babies were born in a toilet bowl and the placental sac were on top of the two babies, that alone could suffocate one or both babies.
It could, yes.
even if these two twins were lucky enough to somehow landed side by side in the confined space of a toilet bowl, they still could have been compressed enough to cause death.
If you're in a toilet bowl and something that is, once again, if your lungs can't expire, something's pressing against your chest, makes it impossible and difficult to breathe, and it can cause suffocation.
And just after delivery, the placental sac or afterbirth, is that a correct term?
It's a term that's used to describe, yes, sir.
That would have been wet.
Yes, it would.
And bloody.
Yes.
Sticky.
It could, yes.
And heavy.
It's kind of a relative heavy. I'm not sure of the weight of the placenta.
But typically, you would expect it to weigh 3 pounds, roughly.
Usually, they're I don't have the charts in front of me. Twin placentals are typically anywhere from 500 to 800 grams. I don't have a calculation converting grams to pounds, and it's a rough estimate. I haven't measured placentas, weight placentas, since my residency. It's been a while. This is just a weight that pops into my head. It's within 500 to 800 grams, I believe.
Okay. And obviously, if a baby were trying to breathe with this wet afterbirth over its face, it wouldn't be able to breathe.
Anything including its mouth or nose would make it difficult to breathe, yes.
And doctor, you talked about the umbilical cord around the neck, and I think General Whitley used the term draped around the neck. It actually appeared, at least to me in the photographs, to be fairly tight around the neck, did it not?
It's hard to tell. Things can actually dry around the neck, and it can cause an indentation. If you die and your head is flexed, you'll have a bunching of the skin, and once you've reflected the head, it still looks kind of bunched and tight, those wrinkles, and it's kind of post-mortem artifact. To really determine how tight that was, I can't determine that. I can say that children are born every day with a cord wrapped around their neck, and it all depends on how long the cord is and how long the mother pushes to determine how tight this is. Does it cause a problem? That's why they monitor fetal heart rates when they're being delivered, and if it starts to decelerate, then they'll do an emergency C-section. I don't know if this child was truly born with a cord around its neck, or if it happened after it was born, after it was placed in the laundry basket.
So you're not really able to tell whether the cord was around its neck at time of birth. Is that correct?
That's correct.
Nor are you able to tell how tight it was after birth.
If it was tight enough to cause issues, there should be some indentation, some hemorrhage in the anterior neck muscles. That wasn't the case.
What is cyanosis, doctor?
It's just blowing discoloration of the face. It's a lack of oxygen.
And can there be cyanosis, and what would you call if there's strangulation, what would you call red marks that are around the neck?
I'm sorry, repeat your question again.
If something is around someone's neck and there's red marks, what would you call that?
I call it a red mark on that. Could be an abrasion. All depends on what it looks like and what you're trying to get me to describe.
Okay.
If there's an indentation there, there may not be. In hangings, you can have an indentation of the neck. On either side of the noose or ligature, you can see abrasions on both sides of the rope or whatever's used. All depends on the nature of the ligature, what's being used to strangle someone with, on what type of marks it leaves on the skin.
And the infant that had the umbilical cord wrapped around the neck, are you telling us that there were no signs of cyanosis?
That's correct. The child did not have marked congestion of the head. Usually, if there's a strangulation, what happens is the veins that drain the blood from the head become blocked first. Those are the easiest to compress. The arteries that bring the blood to the brain are deeper, and it requires more force to block these off. So if there's a wrapping either by the cord, a ligature, or rope, if you can cut off the veins and you keep the blood from draining, the head turns a deep purple. You'll see hemorrhages in the eyes. You can see called petechia. You can see petechia, little pinpoint hemorrhages on the cheeks. and that helps you determine a strangulation. If it's actually deeper and you're cutting off the carotids, which are the vessels that perfuse the brain with blood, you don't see that because you're cutting off the blood to the head and the drainage, and you just have, you lose consciousness rapidly because the brain does not get the oxygen it needs, and within seconds you will actually lose consciousness.
Doctor, would it be fair to say that newborn babies are very sensitive to cold?
Yes, they are.
And that's the reason that you immediately wrap a newborn in warm towels to keep them warm, or put them in special hospital beds.
Right, they're kept for the first 9 months in mom at 98.6 is the average, and then after they're born, they're exposed to the air, ambient temperature, and they have problems with regulating their own temperature. They have to be wrapped up.
And that's the reason babies are sometimes placed in isolettes.
That can be one of the reasons.
Which is, describe for us what that is.
It's a crib that's enclosed, and it's usually has warm air circulating. It can be have a higher saturation of oxygen. All depends on why the kid needs to be put in there.
And some babies are also placed in incubators.
That's correct.
And we could assume that if the baby was delivered into a toilet bowl, that at least some of its body would be underwater.
That's could be an assumption. Yeah, that depends on how much water's in the toilet and how big the toilet is.
And you would assume that water in a toilet bowl would be about the same temperature as the water, as the air in a house.
Sometimes, well, it depends on the time of year. The water coming out of your pipes, if you turn on the cold water, it's not cold immediately. I don't know the temperature in the toilet. I would imagine after time, if it hasn't been flushed in a while, it would be close to air temperature. It would take some period of time to equilibrate after your last time you flush it. That's a guesstimate on my part.
Certainly. And certainly if it was 70 degrees in a house and say in September, mid-September, it's 70 degrees inside the house, toilet hadn't been flushed in a while, you would assume that the water is going to be 70 degrees or close to that.
Yes, sir, I would imagine.
And a baby, newborn, put in partially submerged in 70-degree water would cause immediate distress.
Imagine it'd be uncomfortable as far as cold.
And could certainly cause death within minutes, if not hours.
I'm not sure about as far hours, probably. Haven't seen any studies on how long it takes for a child submerged to become hypothermic and die.
Well, water transfers heat much more quickly than air.
Absolutely. Yes, sir.
So whatever the temperature is, if it was cool enough for a baby to die, baby totally unclothed, die from exposure to air, it would die much more quickly if it had exposure to the same temperature water.
Yes. So they die faster, hypothermia occurs faster in water than in air, yes, if that's what you're asking me.
And if one infant fell in the toilet bowl, that would displace some water, we would assume, and raise the level of the water.
Yes.
And the same would happen if a second baby landed. If it got into the water, that would again displace the water and rise the level.
Yeah, I would imagine, yes. I'm not knowing how big the toilet is, how much water's in the bowl.
And the same thing with afterbirth. If it came down on babies and landed in water, it would certainly displace some of it as well.
I would imagine, yes.
And you really can't tell us how long these babies could have survived in being partially submerged in water, can you?
No, I can't.
And hypothermia could have killed them in a matter of minutes or an hour or two.
It's possible, yes.
And at autopsy, babies who died from mild prolonged hypothermia wouldn't look any different from the babies that died from smothering or compression, would they?
Especially if there's a prolonged period between when the child was actually dead and when the autopsy was done. Hypothermic deaths typically also are ones in which you rule other things out. People that die outside, exposed to environments, you rule out other natural diseases, you rule out things they've ingested, trauma. Oftentimes there aren't signs similar to suffocation. In which there aren't a lot of physical findings or an absence of physical findings.
And doctor, adults who are sick can certainly be too sick to walk, too sick to talk or to cry, but they can still breathe. That happens all the time. Somebody's very sick, they can't talk or cry, but they can still breathe.
Yes.
It takes much less to simply breathe than to talk or cry.
I'm sorry, repeat your question.
It takes much less energy to simply breathe than it does to talk or to cry.
I've been sick before and I haven't wanted to talk. I can agree with that.
So just because babies had air in their lungs doesn't necessarily mean that either one of them could have necessarily cried.
That's correct. You can't, this fact, I agree, but you cannot cry without having air in your lungs is the opposite side of that. Just because there's air in the lungs doesn't mean they cried, but if they did cry, it does indicate air in the lungs.
And you found that both babies' lungs were moderately congested?
Yes.
And amniotic fluid and meconium can cause newborns' lungs to be moderately congested, can't they?
It can.
And just because a baby has moderate congestion doesn't mean that the babies were murdered, does it?
Congestion is not really a specific finding. It's just an observation based on lung weight. Lots of different things can cause congestion of the lungs. It's one of the things we write down and annotate. It's all a weight. It's just the fact that there is blood in the lungs as far as in the vasculature. You mentioned meconium and things you should see that microscopically, which is why I take sections. And on little kids, I take a lot more sections of their lungs than I do on adults. And there was no meconium that I saw in the sections I examined.
And doctor, would it be fair to say that multiple births present a risk of death that's roughly 5 times what a single birth is?
I don't know what the data is, but as far as your number, but yes, increased gestations is a risk factor. But as far as what the number is, I don't know.
Okay. But certainly multiple births are far riskier than single births.
That's correct.
If a mother suffers blood loss during delivery, that could adversely affect the babies.
Anything that the mother experiences, yes, the children, it's kind of a downhill thing after that. Everything the mother experiences finds is translated to the kids as far as acute blood loss at pregnancy can affect the children, yes.
And that could be potentially life-threatening for them.
Absolutely.
If there's an unattended birth, no doctor or nurse around, you'd look for symptoms of blood loss in the mother's description of her labor and delivery. That'd be one of the first things you'd do.
I'm sorry.
If for an example, a woman delivered a baby at home,
yes,
and had substantial blood loss, she totally unattended birth, you'd look for symptoms of blood loss for the mother.
In the mother, yes, you'd look at her. Is she anemic? What's her blood cell counts? Does she look at her heart rates, her respiration rates? If you have a loss of blood, your heart will beat faster. You will breathe faster, trying to compensate for that loss of blood.
And you would look for dizziness.
That's one of the signs also, yes.
And the worse the dizziness, the worse the potential blood loss.
I don't know if it's a correlation. Because dizziness we can't really measure. I can measure heart rate. I can measure respiration rates. I can look at their red cell count. I can't really quantitate dizziness.
That's a fair answer. But if somebody was so dizzy that they fell down, that would certainly cause concern.
Yeah, absolutely, yes.
And you'd also look for a loss of consciousness that might vary. That is, where somebody might be okay to lie down, but if they try to sit up or stand up, they would lose consciousness. That'd be important.
It's possible, yes.
And in fact, hypotension, the reason for blacking out, could be worse if somebody's sitting on a toilet seat trying to deliver a baby.
If you're, I don't know. She's laying down versus seated delivering. Is
Yes.
that? Some people actually, in some cultures, actually deliver seated or squatting. I don't know if there's an increased risk of blacking out if you deliver squatting, seated, or lying down. I can't answer your question. I don't have an answer.
Well, if somebody's had significant blood loss, it's more likely they're going to have more difficulty if their head's elevated as opposed to being
Right, that's
flat.
a reasonable assumption, yes.
And if somebody gave a totally unattended birth, you would certainly inquire, any doctor would inquire, how much bleeding they did before giving birth.
Without measuring the blood, it's hard to quantitate blood loss. I don't have a volume, so typically what we'll measure is a complete blood count before and after birth. Because blood loss, I mean, what looks like a small amount of blood can look like a huge amount of blood. It's hard to quantitate blood loss by, visibly looking at blood on the floor or blood in the bowl. It doesn't take much blood to actually color water. It looks like it might be filled with blood, so it's hard to quantitate what someone sees visibly without having a measurement.
But certainly if a young woman gave birth totally unattended, you would want to try to find out if there had been blood loss prior to the birth.
Correct.
And you'd want to know if there had been blood loss and how much, if you could tell it, during the birth.
Yes. You really want to look at her symptoms after birth. And once again, it's hard to quantitate blood loss, even in the operating room. It's a guesstimate. And it's whether they use blood measurements like they're looking at their red cell count and hematocrit and things like that. You can a hard number versus visible blood loss.
But there can be blood loss, particularly in a birth that's done with no medical supervision at all.
Absolutely.
There can be blood loss both before the delivery.
There can be blood loss during that. As soon as when you lose the mucus plug and actually your water breaks, there might be some blood loss during that procedure.
So there can be blood loss before delivery, during delivery, and after delivery.
Yes.
And doctor, if someone has blood loss to the point that they can't sit up without dizziness and passing out, that's highly suggestive of hypovolemic shock, isn't it?
It's significant for hypovolemia as far as whether they're in shock or not, I don't know. But it is a sign of having low blood pressure, not having enough of blood.
And if someone has hypovolemia or hypovolemia shock, that person could become dehydrated.
I don't know if shock actually correlates with hydration levels at all. Shock, hypovolemia usually implies blood loss. As far as, is there water loss also? I mean, the blood we have is mostly water. I don't know if there's actually a direct correlation between dehydration. If you're dehydrated, you're being more likely prone to show some forms of hypotension as far as dizziness, lightheadedness. So you can be dizzy, lightheaded because you're dehydrated. You can be that because you've actually had acute blood loss.
But if someone's giving birth totally unattended and bleeds, we could certainly assume they're losing red blood cells as well as other bodily fluids
Yes,
while
sir.
bleeding. And if a mother has hypovolemic shock or hypovolemia, that can decrease the baby's chance of survival.
If they're still in utero, yes. If they're still actually, if they haven't been born yet, yes. After the children are already born, sort of on their own, so to speak, as far as they're no longer connected to the umbilical cord, they're no longer responsible for mother for oxygen, red cells, they have their own.
But a mother who delivers totally on her own without anyone to help and tend to the birth, no medical attention, if she were to pass out with newborns, not able to tend to those newborns, not able to keep them warm, those kind of things, that can lead to death.
Yes, it can.
And simply taking a person's blood pressure while they're lying still or sitting doesn't necessarily tell you if that person has suffered extreme blood loss all by itself.
That's correct, it does not.
Evidence-based medicine would demand that you check blood pressure lying down,
Yes.
sitting, or standing,
That sounds reasonable, yes.
and do a blood clamp
Yes.
and check electrolytes.
Yeah, there's many different reasons to have a low blood pressure. It's multifactorial. You look at all the factors that can cause a low blood pressure.
And doctor, if these two babies we've been talking about were in the toilet bowl together and with the afterbirth, assuming that was on top of them, certainly time wasn't on their side.
Oh, that's correct.
And doctor, I mentioned the term, I think, a few minutes ago, evidence-based medicine. Ask me if this is correct. As a forensic pathologist, would you say that evidence-based medicine means the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of patients, or in this case, the cause of death?
That can be a good definition.
And in fact, you relied heavily on the information given to you by law enforcement in coming to your conclusion.
That's correct, I did. That's not anything particular about this case at all. I mean, all my cases, I rely heavily on law enforcement for scene investigation because I cannot physically go out there,
Sure.
particularly in the outside counties.
And, doctor, your report indicates that both babies were 6.5 pounds.
That's correct.
And I noticed that when you did other measurements, they were expressed what I might term more precisely. Is it unusual to just say 6.5 as opposed to have it in pounds and ounces?
It can be either or. It depends on our scales. The scales we have in the autopsy suite aren't digital scales for that, so you get an estimation within probably a few hundred grams, if that, on the actual scale itself. So it's the smaller organs are all weighed electronically because it's a smaller scale. The organs are smaller, but the actual the bodies themselves are weighed on a scale that renders it in pounds.
Well, it's pretty common if a woman has a baby to tell someone what the baby weighs, and typically it's expressed in pounds and ounces.
Correct, typically.
And you had them 6.5 pounds each, is that correct?
That's correct.
And the term discordant twins means twins are of different sizes.
That's correct.
And would you have any explanation why others who had viewed these babies early on described them as discordant twins?
I don't have an answer for that.
And would you have any explanation for the death reports that describe one twin as 3 pounds and the other 5 pounds?
On our scale, they were weighed at 6.5 pounds.
do you have any reason why that the Hendersonville Police Department would describe one baby as being clearly smaller than the first?
I don't have an answer for that. All I know is at the time of autopsy, on the scales in the back, both weighed 6.5 pounds, and the other measurements are written down in that same paragraph. As far as how one person describes the kids, I can't answer how someone else describes something or weighs something. At the time of autopsy, on the scale I used, both were 6.5 pounds.
Well, doctor, let me ask you about that. Do you have these reports in front of you?
I do. I have the...
And if you'll turn with me to baby boy number 1. And that says case number near the top right-hand corner, MEC 11-1754.
Yes, sir.
Do you see that?
I do.
And if you'll turn with me over 2 pages, and the second paragraph, see where it says identification? In bold letters, it says identification, two pages over.
Can you tell me what page you're on?
I'm sorry. There's a cover sheet, I suppose. So it's page 2 of 4.
Page 2 of 4. Yes, sir. I'm there.
All right. See where it says identification?
Yes, I do.
And read what it says right after that.
Identification, the right ankle bears a yellow plastic identification band which reads MEC 11-1754 and baby boy Lowe number 1.
And doctor, if you will turn to or get your report of baby boy number 2, and that has the case number 1755.
I see where you're at.
You see that?
I do.
All right.
It's a misprint on my part, a typo. I didn't catch it. Identification, they both have the same number, MEC 11-1754 in both cases, and baby boy Lowe number 2. I spell check. I didn't catch it. It's a typo on my part. It should say 11-1755.
Okay. So what you've kind of jumped ahead of me. What you're telling us is that on the second page where it says identification, it says the right ankle bears a yellow plastic identification band which reads 1754 and baby boy number 2, and 1754 is the same number as baby boy number 1.
That's correct.
All right. And doctor, I know you said you couldn't explain anyone else's work other than your own, and that's certainly a fair statement. But there was a lady, an EMT paramedic, Barbara Jones, who testified a couple of days ago before this jury, and she was there and said that the baby was full term and could possibly have weighed 5 pounds. And you wouldn't have any explanation as to why that would be.
5 pounds versus 6.5 pounds, there's really not that much of a difference between the two. You're talking about 1.5 pounds as far as what someone looks at and tries to estimate versus the scale. I don't have an answer for that.
And doctor, the way this witness chair is set and the rail around it sometimes is difficult for me to see. I embarrassed myself the other day because I saw a witness looking down and thought that witness had notes, and turned out they didn't. Are you referring to notes?
At this precise time, as far as I'm looking at my autopsy report is all I'm looking at.
Okay. May I see what other notes you have?
So this is part of the file. There's no notes for this case. This is just a part of the file. As far as my subpoena and things, there's no notes.
I see that.
Sure.
All right.
That could be a scrap piece of paper I'm writing on.
Sure. Thank you, Doctor. Doctor, is the survival rate, and I'm probably going to mess this up trying to say it. Help me out. Monaamniotic. Monomanic. How do you pronounce that?
Monoamniotic.
Monoamniotic.
Okay.
It sounds a whole lot better than what I tried to get at. That the survival rate for twins like that is between 50 and 60%.
I don't know what the answer for that is as far as the survival rate for monoamniotic twins.
And doctor, cord entanglement for twins that share one amniotic sac is a lot higher than a single birth.
You asked me for rates of incidence of.
I didn't have a percentage on this
Okay.
one. I just said it was a lot higher than a single birth.
I don't know.
And twins that share the same sac are extremely rare, aren't they?
It's more rare, yes. As far as the incidence, I don't know.
Okay. One in about 60,000, would that sound about right?
It would be a complete guess on my part as far as the incidence of.
But certainly a pregnancy where two twins share the same amniotic sac is considered high-risk pregnancy.
Yes.
And Vanderbilt and Centennial Women's Hospital in Nashville both have high-risk pregnancy groups, do they not?
I don't know. It makes sense that they would.
But generally they're not in more rural and suburban areas. They're generally in cities.
It seems reasonable.
And you don't know of one in Sumner County?
I don't know of one where I live at.
Okay. In Jackson, Mississippi?
I'm sure they do at the hospital there, but as far as the locations of those things, I'm not sure.
And doctor, I know that these babies were discovered apparently about 36 hours roughly after birth. Do you know how flexible an umbilical cord is at room temperature and exposed to room air after that period of time?
No, I don't. Typically, I receive them. I've always received them within hours or less than a day afterward, and they've usually been in formalin. It's a fixative like alcohol, and they get kind of rubbery. But as far as how flexible one is at room temperature or covered up after 1.5 days, I don't know.
And doctor, twin that's been referred to as number 2, with the cord around its neck, had the same weight as twin 1.
Yes, on my scale, yes, 6.5 pounds each. The other numbers are slightly different, but they're all within, looks like a centimeter or less of each other as far as the rest of my weights.
But his brain size was significantly less.
64. I'm not sure if I'd say significant. It's 30 grams, which is really not that much weight.
Well, it's about 10%, right?
But as far as it's still within the normal range for kids at 40 weeks gestation, there's going to be some variation that should not be identical. I'd be surprised if they were as far as all the weights being identical. But there's going to be some variation between kids and even people of the same age and same height are going to have different weights of organs. And 30 grams, 330 grams versus 364 grams is not that much of a difference, I don't believe.
So 10% difference in brain size between twins you don't think is significant?
As far as it's still within that realm of normal for a 40-week gestation kid, so I'm not too worried about if it was at the low end of normal or if it's below what I'd expect for 40 weeks, then I would get more excited about it. But the fact that it's still within that normal range for a 40-week gestational kid.
If the child that had the umbilical cord wrapped around his neck, if that cord was around his neck in utero, that is inside the mother's womb, that could account for the difference in brain sizes.
It depends on, is there tension on the cord? It would be a speculation on my part. It could, yes. There's many different factors that affect how fast we develop, when we develop, how much weight we put on. So there's more factors than just having, is there a cord or not wrapped around the neck.
And if a cord is wrapped around a fetus's neck in utero, it could be at significant risk for cerebral palsy.
It could. Especially if the circulation is cut off. If it's so tight that you can't get blood to the brain, it causes brain damage then. It's called an anoxic event, and you can't see that microscopically. And if kids survive it, they'll have some type of cognitive defect as far as abilities, physically or mentally.
Your Honor, if I can have just a moment. Earlier about the page twos and that baby boy number 1 and number 2 had had the same number. You said that was an error. Is that correct?
On my part, yes.
And on the cover, the report of investigation by county medical examiner, the very front page, in the first line under the narrative summary, both baby boy and baby 2 have the same number as well. Is that correct?
Apparently, yes.
It says reportedly this white male infant was found unresponsive along with his twin brother, and it says 11-155, and that same 155 number also appears on the first sheet of baby boy number 1.
It has the same number, that's correct.
And that, I assume, is also a mistake?
Apparently, yes, sir.
Doctor, does this appear to be a photograph that was taken during an autopsy?
It was taken at the time of autopsy. Yes, it has our number at the bottom.
And doctor, does it not appear, at least in the photograph, that the cord is pretty tightly around the neck?
There's blanching on either side of the cord. The skin is purple both above and below to some degree, but it seems to be more of a linear line here. So I would interpret that as being liver, because the kid was on this side.
It's being what, doctor? I didn't hear you.
Liver, L-I-V-O-R. It's post-mortem pulling of the blood in the skin. You can see there's blanching here, like something was pushing against the abdomen. There's pressure here. So I believe this is all post-mortem artifact is what you're looking at.
But the cord around the neck is not necessarily post-mortem artifact, is it?
At this point, I can't tell in the photograph itself whether this happened before the child was born or after the fact.
But when that infant was delivered to you for you to perform an autopsy, that cord was around his
Yes, it was.
Your Honor, asks this to be made in this exhibit.
The exhibit number 90.
Your Honor, please, that's all the questions I have for Dr. Davis. We have copies of these for the jury if Your Honor wants me to publish these now, or if you, of the exhibit that was just introduced.
Okay.
I didn't know if Your Honor wanted me to do that now or wait till General Whitley's through.
As the exhibits, what we'll do then, Mr. Pellegrin, is we'll just pass them on at the same time. Sure. Mr. Pellegrin?
That's fine, Your Honor.
I'll send a copy of this photograph along with the others at that time.
Yes, sir.
Would that be acceptable?
Absolutely, Your Honor.
Okay. General, you may read the record.
Dr. Davis, all the questions about the numbers of the babies on this facing page, you've already explained the typographical error. You did autopsy 2 babies.
That is correct, I did.
They were different.
That's correct, they were.
And you've identified pictures of the 2 babies that you did autopsy.
Yes, I did.
And the front page that Mr. Pellegrin has referred to on the autopsy report was not prepared by you. Is that correct?
No, it was not. In fact, that paragraph was written by one of the investigators in the office.
Mr. Pellegrin asked you about evidence of cord entanglements within the womb. Did you see any evidence of cord entanglements that had occurred in the womb?
I did not, no. I did a dissection of the neck. It's called a forensic neck dissection. We go layer by layer, looking at any hemorrhages, any things within the actual muscles of the neck, showing that there was some kind of compression or injury, and there was not.
And specifically with baby boy number 2, he just introduced through your testimony the last exhibit in this case. Did you determine whether or not the cord up around the baby's neck had any effect on its health and welfare?
Didn't appear to, no.
And how do you say that?
After the dissection of the neck, the child appeared healthy. There were any other injuries to the neck itself. Outside of just being placed around the neck, and also it's speculation that the child was born at that point with a cord wrapped around its neck. There doesn't seem to be any injuries to the neck itself.
No, any evidence at all of strangulation by the cord?
None by my investigation, no, sir.
And did you investigate that particular possibility?
Absolutely. When the cord was around the neck, I did a neck dissection and looked for any type of injury to the neck structures, and I did not find any.
Are the heights of these two babies the same, or are they different, Dr. Davis?
The height will be the crown hill length, and they are different. There's looks like a little over a centimeter difference between the two babies. So the heights, I measured the length. Lengths are different on these kids. The crown hill length is the top of the head to the bottom of the heel.
And the crown length of baby boy number one was what?
Number one was 48.8 centimeters.
And with regard to baby boy number two,
Is 50. He's a little bit tall, a little bit longer. 50.1 centimeters.
50.1. Generally speaking, were the weights of the two babies very close to one another?
My scale has them both at 6.5 pounds.
I'm sorry, that's a bad question. Generally speaking, were the internal organs that you autopsied, were the weights of the two babies very similar or not?
I didn't compare them side by side. I mainly compared them to determine gestational age. I can do a quick estimate.
All right, would you do that? I'm specifically referring to page 2 of the autopsy report.
As far as the head circumferences, chest circumferences, they're all within either a centimeter or less of each other as the other measurements.
All right.
Crown rump, abdominal circumference is a little bit different. Head circumference is a little bit different than others are very similar.
Okay. And early on in the cross-examination, Dr. Davis, Mr. Pellegrin talked to you about weights being placed on the baby's chests.
Yes.
Remember that testimony?
I do.
The first baby to be born, if the baby were born inside or in the toilet bowl, there would be no weight at that point to be on that baby's chest. Is that right?
I would imagine not, no.
All right.
The other child had not been born yet, and the placenta had not been delivered.
All right. So there's no weight to be had on the baby's chest.
No.
And when a woman gives birth to twins, they're not born simultaneously, are they?
No, sir, they're not.
There's a first birth and then a period of time to the second birth.
And that time can vary.
It could vary greatly, could
Yes,
it
sir,
not?
it can.
You have no idea, do you? Or I should say this. Do you have any idea as to the time differential between the birth of the first baby and baby boy number two?
I do not know the interval between when the first child was delivered and the second child delivered.
And you don't know how the configuration of the commode that she was given birth in, do you, Doctor?
No, sir, I don't.
You've never seen that?
I have not seen the bathroom at all.
All right.
For the bathroom in that house, excuse me.
Right. Did you see any evidence at all, Dr. Davis, that either one of these babies, baby boy number one, baby boy number two, had hypothermia?
When I examined them, they were cold, which happens after death to all of us. There's no evidence for hypothermia, but hypothermic deaths are usually devoid of some signs, which is why we use also on those is the case history and what they found outside, what they found in the snow. A lot of it comes down to scene investigation also.
All right. Is it good technique within your field of expertise of being a forensic pathologist to determine what the background and circumstances are for a person you're doing an autopsy on?
Absolutely.
Excuse me, Dr. Davis, could you keep your voice up?
I apologize, Your Honor. Oh, sorry, sir. I apologize, y'all.
Okay. Did you heard my last answer? And well, I mean, my last question. What was your answer?
I'm sorry. Repeat the question again.
Is it good a technique within your field of expertise as a forensic medical examiner, forensic pathologist, to determine the background information which led the person to be autopsied in the first place?
Absolutely. It's always good to have more information versus less. Oftentimes, when I receive the bodies, all I have is a body and maybe a cover sheet as far as a story. Sometimes the story is as short as man found dead. So the more information I get from either scene investigation, law enforcement, crime scene investigators, all information I use then to determine the final outcome, especially if there's an autopsy in which there's very few findings. I rely heavily upon scene investigations and the investigation of the law enforcement.
And Mr. Pellegrin asked you quite a few questions about the mother giving birth and having a lot of blood loss. Do you remember that?
I do, yes, sir.
All right. Does blood loss during the birthing process itself affect the child being born?
If there's acute blood loss during pregnancy and there's a prolonged delivery, yes. Not knowing the interval between when the blood loss starts, how much of the blood loss there is, and how long until the first child is delivered and takes his first breath. All that takes into factor as far as how much the detrimental effects it is on the unborn child.
It certainly would have an effect on the child if there was acute blood loss during the course of the pregnancy.
Yes, any acute blood loss would have an effect on the pregnancy, yes.
Assuming there wasn't any acute blood loss during pregnancy, during the actual birthing process, once the child is born, it doesn't affect the child, does it, as to how much blood the mother is losing or has lost?
Once the child is born and the cord has been removed, those factors of what the mother's experiences aren't as detrimental or don't really play much of a role in the actual, once the child is outside the uterus. What the mother experiences as far as blood loss, things she ingests, those things all affect the child once they're in utero. Once the child's been born, those don't play as big a factor.
It pertains only to the mother.
That's correct.
And he asked you about Barbara Jones and her testimony that she thought the baby was about, one of the babies was about 5 pounds. Remember that question?
I do, yes, sir.
Do you have any idea whether Barbara Jones picked the baby up and tried to give it a feel for the weight of the baby?
I have no idea how she came up with the weight. It's just a guesstimation based on its appearance. Did she actually weigh it? Did she pick it up? I don't know. I mean, she was close. She was 5.5. Did she say 5 pounds, 5.5 pounds, and it was 6.5?
I think the question was 5 pounds. But you don't know. You don't know Barbara Jones.
I do not know, sir. I don't.
You don't know what she did.
No idea, sir.
That's all I have, Your Honor.
Any recross, Mr. Bell? Officer, if there's anybody in the audience that needs to be excused, you may be excused.
Doctor, Mr. Whitley asked, I'm sorry.
We've been kind of lengthy here.
Yes, I'm sorry.
All right, go ahead.
Doctor, Mr. Whitley asked you a question about mother's blood loss affecting birth of a child. If there are twins born and there's a lot of bleeding in the interim between the first birth and the second birth, the blood loss of the mother could certainly affect the second child born.
Yes. The blood loss affects the unborn child, and also how much of the blood loss there is. So the more blood loss there is, the longer interval in which the child is exposed to an environment where there's not enough blood, not enough oxygen, that's going to have more of an effect.
And, Doctor, you said that as part of your duty as a forensic pathologist, you rely heavily on scene investigation.
Yes, sir, I do.
And you rely heavily on what officers at the scene tell you in person.
That's correct, I do.
And you rely heavily on what investigators at the scene communicate to you by other means, such as a written report or some other writing.
Yes, I use their reports to then form judgment as to my findings also, as far as it's in my summary.
And that's an important part of your ultimate conclusion, is the information imparted to you by the officers investigating the case.
Yes, sir.
And certainly in this case, the information imparted to you by Detective Malik or whoever you had contact with certainly had an influence on your ultimate conclusions.
Yes.
That's all I have.
We'll pass on. Dr. Davis, I know you're very busy. You may be excused, sir. Thank you for coming.
Thank you, Your Honor.
We'll take a lunch break, ladies and gentlemen. Before we do, this is a good point to pass. I'll pass exhibits 85 through 90. Split these up, 3 a row here. See what we're passing out the autopsies. Okay, let's pass them out, get them out of the way. Give me the 2 autopsy reports back. Mr. Pellegrin, you say that you have the copies of those photographs. We can go ahead and,
Yes,
okay, we'll go ahead and pass that since we have individual copies. And then lastly, I'll pass around everything. We don't have copies of. All right, wait till they see these exhibits, pass them around, then we'll pass these so they can see them one at a time.
Okay, at this moment they're about to break for lunch. I think there's still some business to address here. They're waiting for the jury to leave to go to lunch, I believe. And they're doing something with the photographs right now, Nick?
Yeah, they're publishing the photographs to the jury. I don't know.
Okay, so the jury may still be in there looking
No, they're
at the
still
photos.
in there. They're looking at the photographs.
All right. I wonder if this concludes the prosecution's side of this case. We'll see. They said that was their last witness, I believe. And they got back and forth across. We'll get into more detail here in a moment on what we thought of how things went. But we did indeed finally hear from a forensic expert on the cause of death. Pretty fascinating stuff. And I think in a lot of ways, again, pretty damaging for Lindsey Lowe.
I don't think it helped her.
Yeah.
That's for sure.
But, I mean, under cross, the question is, how was she smothered? If he said that they died, or how were the babies rather smothered? Was she involved, accidental, intentional? That's what it's going to come down to, right?
Well, that's exactly right. And John Pellegrin did a good job of trying to take the state's expert and turn it into his own.
Yeah.
And he really raised some good issues. And, of course, right now, after they publish these to the jury, then they'll probably leave, and then the court will ask the state if they rest, if that's the end of their proof, and if so, they'll probably take up a motion for judgment of acquittal while the jury's gone to lunch, and then maybe some other housekeeping things, and come back and get into the defendant's proof after lunch.
Yeah, for the viewers wondering, standard procedure usually after the prosecution finishes its stage of the evidence, that the defense will sit up and say, Your Honor, they did not prove their case. We ask that our client be acquitted. Pretty standard, okay? It's not like...
You have to make it.
Yeah,
even
you
if
have
you feel like they've proven it.
How many times have you ever seen a judge say, you're right, she's acquitted, you can go?
Maybe, not acquitted, but maybe 3 times I've seen some counts of an indictment be dismissed.
Be dismissed, right. So that'll happen. And we want to touch base on you. This gavel-to-gavel coverage for us, we want to show you everything the jurors are witnessing. If you watch from beginning to end, you'll see everything, save the autopsy photographs. And that was a judgment call by the photographer in the courtroom, and discussions about just how graphic they were, and that was something we chose just not to show in our coverage here. And to some degree, then, that means as we sit here talking about the impact of the testimony by Dr. Davis, these jurors got to see apparently some very, very graphic photos of these poor babies, and what impact that might have on them. I can't help but think anyone who sees that one is going to be just, very upset by it, and also maybe could get a little angry that something like this would happen to helpless infants. They saw those pictures. We did not. Nick, seeing them for real as opposed to just hearing the descriptions as we did on TV, there's a difference there. I think these jurors seeing that, I wonder what impact that might have.
Well, it's definitely going to, I think, hammer home the fact that we have 2 infants here who have lost their life, and I think it's definitely going to have an impact on them. Obviously, Miss Lowe made it through this portion, and she definitely had to do that.
She maintained. The judge warned her. Another outburst, and I think he anticipated showing these pictures was going to be hard for her. And I think we heard some sobbing at one point.
Yes.
Which is okay.
Which is okay.
It's the big emotional outbursts that the judge said, no more of that from you.
That's exactly right. You can't help but to show emotion. You're going to have her parents, you're going to have her friends, you might even have jurors in there showing emotion over this.
Right.
But again, you can't have these uber outbursts of emotions, while the case is going. And of course, again, both of these 2 outbursts that we've seen by Miss Lowe seem to be tied to Mr. Smith.
Yeah. Again, as we speak, those photographs we were talking about that were shown up on the screen the jurors are now being passed individually to the jurors one by one to give them an opportunity to scrutinize them. Now, this, again, will be yet another exhibit, these photographs. And once they go back and begin deliberation, if they choose to have some of these exhibits brought into them during the discussion, they can look at these all again, right?
That's right. All the exhibits are left in the jury room with the jury. Now, if you have a firearm or something like that, or, firearms sometimes will go, but especially drugs, if you've got a carload of cocaine that's an exhibit, they're not going to send that back to the jury room.
Right.
If they wanted to see it, a court officer would bring it in there. But all 80-some odd of these exhibits will be back there for the jury to look at their leisure, should they decide to review them again. But I have since there was not a transcript of the tape-recorded interview, I have a sneaking suspicion that they're probably going to want to view that again.
Oh, what there is? You mean, they can view it, but there is a transcript.
Well, I didn't know the transcript was provided to each one of them.
I see. Which they could, but you're right. They could call in and have, we want a monitor in here so we can view that interview again and see some of the points.
Well, they'd probably bring them back into the courtroom.
All right. Well, when they do take their break, of course, those of you watching us on the Plus or online, wherever you may be, and again, I've said we've gotten emails from all over the country. In fact, some of these may be from around the world. You can watch us on streaming video. We'll open up the phone lines. We'll get to your emails. You'll want to jump in on that. I think a lot of people may have comments about Jeremy Smith. We finally saw this mystery father. We knew his name, but no one had seen him. There were questions, what skin, race, color was he? And, of course, Caucasian. And he came in, and I'll tell you, the interaction he had at the end when he was on the stand with John Pellegrin, the defense attorney crossing him, was, if nothing else, entertaining.
Yeah, but I think it also goes to show how even keel and calm Mr. Pellegrin is. He didn't seem to get too fired up. He seems to be kind of very level-headed through this whole process. And this is something where emotions would definitely run high.
Yeah, if you missed that, later today's clips of this will be shown so you can see it. But I think that Jeremy Smith took exception to some of the line of questioning and fired back. It's the first time we've really seen a witness of the 13 that have been called by the prosecution really kind of get a little bit hostile back and forth. But hey, that was fine. And he's not charged with anything. He was a witness. He didn't like the line of questioning, and he let the defense attorney, John Pellegrin, know about it. So, but we can hear what you thought about that. And then, of course, the big thing here, cause of death, suffocation due to smothering. And then the follow-up question from the prosecutor, how so was the child smothered? Smothered by someone else. I classified it as a homicide. That from Dr. John Davis. Now, under cross-examination, you're saying John Pellegrin tried to make the case that this could have been